A warm welcome to everybody who's joining us today. Just give our participants one more minute to join us. So thank you for your patience. Good day to everybody, wherever you are in the world today, joining us. It's very good to have you with us. It's snowing heavily here in Geneva, and a couple of us are at home with piles of snow outside. But I'm sure there are many of you in warmer climes, and anyway, it's wonderful to have you here today. I'm Sarah Hess, and I work in the Health Emergencies Program of the World Health Organization, and I will be moderating this webinar today. This is the fifth webinar in the series and the final webinar. If you've been following this series, welcome back. If not, you will be able to hear a little bit more later in the program about the series, looking back a little bit at what has been covered over the last 4 webinars. So this webinar is about the Infectious Hazards Foresight Initiative that WHO embarked on along with partners earlier in the year. And the idea behind this initiative was to really imagine the future of infectious threats. So during the last 4 webinars, WHO has convened a number of thought leaders and influencers from across a diversity of disciplines to discuss the future, to look at global trends that are impacting the course of this pandemic, and then to build consensus around a group of collective actions that the global health community can take to mitigate both the ongoing impacts of the pandemic, but also other infectious threats that might occur in the next or near future, rather. So we will have a presentation from 2 colleagues, Dr. Nikki Shindo from WHO, who leads this work, and then Alexander Alexiou, who is the senior foresight strategist at Arup, the company that has been partnering with WHO to lead this work. And then we have a number of distinguished panelists who will have a discussion around the subject. As per always, we are live streaming this event to YouTube, so you will be able to find it afterwards there. We will be able to share the link, and we will have a time for questions and answers at the end. So if you do have a question for our panelists, please do put it into the Q&A function on Zoom, and we will try to have time to get to it later on. So to open this webinar, I would like to invite Dr. Nikki Shindo to speak. Nikki has a PhD in medical science, microbiology, and cell immunology, as well as specialist training in infectious diseases and public health. She has an extensive experience in many emergency settings and outbreaks, and Nikki is the current lead for this newly created unit for epidemic forecasting and infectious hazard strategies at WHO. So welcome, Nikki, and you have the floor.
Thank you very much, Sarah, and it's so nice to see you all, and thank you very much for the panelists to join us today, and greeting from very snowy Geneva. So I had the privilege really to join and run this exercise this is really a new approach, the foresight itself for WHO. We have gone through extensive reviews as part of the United Nations Technical Agency of Health. We are so much used to shape ourselves based on past experience, meaning that the reviews are mainly and basically the way we used to conduct after major infectious disease pandemics and outbreaks. And there are, of course, many things to learn, and we find many things that we could have been doing better. And then we certainly will strengthen these deficits and gap, not only us as WHO, but all the health partners and also member states and other communities joining this pandemic preparedness workforce. But we started new way of thinking. So in addition to those major reviews conducted by independent panel of the pandemic response that are set up by our Director General, and also based on the International Health Regulations Review Committee, and lastly, a Global Pandemic Monitoring Board, which was set up to engage political leaders to join the force of pandemic preparedness. These major groups have published a decent reviews, and that really is a setting a base for moving forward to make the world better prepared for the next major epidemics and pandemics. But in addition to that, our leadership thought about shaping ourselves towards our future. If we look back, then we were bound to what we were missing. And this effort of foresight is really to imagine the future. It is very different from forecasting and projection based on the current situation, but it's really to imagine the future. What's the best future we could think about? And what are the major issues that we can imagine which will be happening in the future? So if we can identify these risks, which may take place in the future, then we can think about solutions now, and we can task ourselves, and each of us have different roles to play, but who's going to play what, and what are the actions now? We can do that. So this was a very new approach for us. So we did our own research based on our database, and also we engaged strategic and technical advisory group for infectious hazards that regularly help us to respond better and plan for the future, as well as the panelists for the 2 workshops and also 2 roundtables. We were building these exercises starting from our usual partners and then expanding beyond our traditional partners. So it was really amazing evolution and journey that brought us here today. And we're very happy to report the outcome of these great exercises. I would say that this is the first attempt, and we will soon put our report and the videos of the 4 scenarios that we managed to develop about the future on the public domain. And then we'll invite public opinion that we can further shape and polish our future. Starting from the very basis for our pandemic preparedness, if I may share just one image by a slide. Would I have access to presentation?
Apologies, Nikki. Let me do that right now.
Okay, thank you very much. I just want to show one slide.
You should be able to share your screen now.
Okay, well, thank you very much. So this slide, okay, it's projecting the major event since the beginning of 21st century. And
Nikki, I'm very sorry
yes,
to interrupt. We see
yes,
presenter mode, so it's very small.
okay, how about that? Do you still see a small screen?
Yes, it's still small.
Let me try again. Is it better this time?
It's still, if you click on the first slide and do slideshow, it should be fine.
Well, I'm doing that, but
Oh, right.
okay, well, sorry about that. Well, I just wanted to say that there are so many major outbreaks and epidemics based on our statistics at WHO. We have about, in average, 170 to 200 outbreaks. So to say those small seeds of outbreaks that could become really a major event. So the seeds are there every year, and we know where are the hotspots are. So I would say that major epidemics will definitely will come in the future. So it's not too late. While we were responding to current COVID-19 pandemic, but there are still those little seeds are sprouting, and we have to be better shape ourselves, even in the middle of this pandemic. So when we started this procedure, we thought about three very simple scenarios based on our experience. So the first was everything goes well and we will see the happy end. But when we reached the happy end, then, but our question was ever after, because all the human rights questions and the economic impact and job losses. So these programs that we faced during an pandemic will come back, and our leaders definitely have to answer these questions, and we have to deal with this. Even the disease itself is under control. And the second was more or less the expansion of the current situation, like a whack-a-mole. We hit one mole, but the other mole will pop up, and we have to hit the other mole. So this is whack-a-mole situation that we do a chasing game after new emerging variants of COVID-19. The last one would be more compromised with other major epidemic event comes up. And then we really have to send out contradicting messages to control these two major events. So these were the first three scenarios we reached. But now, then at that time, we thought about engaging professional foresight specialists. Those occupations are called futurists, and then we will soon invite Alex, who walked us through this exercise. So I had a chance to meet with several futurists, and these futurists, we were so impressed that they have a very positive and attitude, and working with futurists was a great fun. So people who constantly look at future and think about future and shaping now towards the future, it's very positive attitude. And this is really a great news that we think about future and having fun towards this foresight exercise. So with that, I think we're ready to invite one of the futurists and Alex, who really gave us a very strong technical background and then also a professional way of very stratified and intelligent way of conducting foresight. The foresight is a new area of work, and perhaps those of you who work closely with finance sector and also government are now using this foresight as a new approach to shape better ourselves. Obviously and inevitably, our imagining future, because we set the goals very short, 3 to 5 years, so that we can take immediate actions based on this foresight exercise. So it was inevitable to start from COVID-19. So it's heavily impacted and affected our and the panelists and people who join us for the foresight exercise to start from COVID-19. But we meant this to be more applicable for different diseases. But this was this exercise starting from COVID-19 is really well reflecting the future pandemic caused by acute virus infections. So with that, I just want to thank everyone who really contributed this exercise. All the partners joined, and then panelists for the workshops and roundtables, as well as WHO staff across the 3 levels, starting from a country, at the region, and the headquarters. Special thanks goes to the task team members that really supported us to start up our foresight project. Well, thank you very much. I'll stop here and back to you, Sarah.
Thank you very much, Nikki, for that. And yes, you started to introduce Alex, and Alex will be our next speaker. Alex is the foresight specialist and foresight strategist from Arup, and he has worked extensively with many different organizations across virtually every industry and sector to help to identify and analyze trends and explore future possibilities and plan scenarios that build resilience for the future. So Alex, we're really interested to hear you speak today. I believe you're going to share with us the draft recommendations that came out of the first 4 events and roundtables. So over to you, Alex.
Thank you very much, Sarah. Thank you for the introduction. And Nikki, thank you for that, for opening the session. That was an excellent summary of what we did, right? And what I'm going to do now today is really build on what Nikki mentioned. So good morning, good afternoon, and good evening, everyone. Well, as Sarah mentioned, my name is Alex. And for the past few months, I have been working very, very closely with Nikki and her team in the WHO on this scenario planning exercise, right, to really explore the future of the COVID-19 pandemic and other infectious threats in the next 3 to 5 years. As Nikki mentioned, COVID-19 pandemic is, like we use the COVID-19 pandemic as, like the most tangible example, right? But this exercise really is, goes beyond COVID-19 pandemic, is about more than COVID-19 pandemic. I will share my screen, and for those of you who haven't joined us in the past, or for those of you who are joining us for the first time, there are 4 more webinars, and we talk extensively about foresight and foresight methodologies and foresight approaches, as well as the trends that we identified and used to really build this scenario planning exercise. There is also a session on the scenarios themselves. But today, as Sarah mentioned, I am going to give you a preview, a special preview of the video that's going to go public in a few days. You know, you are lucky. You are the first to see the final version of the film we created for these 4 scenarios. And I'm going to quickly just run you through the process so far, right? This is not extensive. This is not very detailed. This is not very technical. So if any of you have questions, please feel free to put them in the chat, in the Q&A box, and also feel free to get in touch separately. I will be more than happy to answer any questions that you might have. As Nikki mentioned, we started this exercise earlier in 2021. It was June, if I'm not mistaken, and through a very rigorous process of research and analysis, but also through an intensive, let's say, program of engagement with subject matter experts, with healthcare professionals, with epidemiologists, but also with professionals and experts from a wide range of industries and a wide range of sectors. We really managed to create these 4 scenarios, and we managed to really validate them, refine them, expand them, and make sure that they are really covering what they should cover, right? Scenarios, we use scenarios because they are exactly a very good way to cover many issues, right? And we, as Nikki mentioned very correctly, we were not interested only in the pathogen and host characteristics, right? These are things that the WHO and the technical teams within the WHO really know very well. But we were also interested in figuring out how the public health response, for example, but also how all these contextual factors really shape the future of the COVID-19 pandemic and other future infectious threats. So through a range of workshops and interactions with WHO staff and external experts, but also leaders from different sectors and different industries, we managed to refine these 4 scenarios, and most importantly, we managed to talk about what to do next, right? Another important thing to remember in this exercise is that the scenarios are the heroes of this exercise, and you will see that they're presented in a very creative way, in a very visual way, because really they are the core of this exercise. But the ultimate aim of the scenarios are to really capture the imagination of people. They are strategic, they're an invitation to a strategic dialogue, really, right? So as Nikki mentioned before, they are not predictions of the future, but the scenarios are just a way to illustrate the plausible pathways that the COVID-19 pandemic, but other also infectious threats could take in the future, right? So today we're here, November, December, we're almost done. So I think this is the last webinar. It is slightly emotional for me because it signifies the conclusion of a very important project for the WHO, for the ARC team, and hopefully for the world. Just a little bit more detail on the process, right, and what we actually did, just to give you a flavor of how we reached where we are today and how we produced these 4 scenarios. These exercises usually start with identifying all the trends that are shaping, like the future of an ecosystem of change, right? And in our case, the ecosystem of change is this ecosystem of infectious threats, right? And again, COVID-19 is at the center of it because it happened now. So we are using the COVID-19 example to build our thinking around what other infectious threats might look like in the future. So we mapped the components of this system. We identified key factors, and key factors, what we call key factors, are usually the trends that have that are more actively shaping this ecosystem, that are more actively driving how this ecosystem might look like in the future. So we identified these trends and key factors, and we developed projections. And projections are really mini scenarios within these trends. So if we're looking, for example, on the key factor or the trend of transmissibility, then there are different ways that transmissibility can really evolve in the future. So we really looked into all these projections, and we made sure that like combinations of these projections gives us some consistent and plausible scenarios for further refinement. This process was a combination of quantitative and qualitative research. I mean, it was based on a very strong scientific base and a very strong evidence base, and was also based on some software, proprietary software that we have in Arup and that we have developed in Arup that helps us with scenario planning. And that was the production. That was, you know, like the scientific, the really hard technical thinking part of the process. And what we did after that, we really engaged a broad range of global experts to review and validate the scenarios, right? What we had at the beginning was a very factual description of what the future might look like, right? What the future of COVID-19 and other infectious threats might look like. But we really wanted to hear from experts and really test our assumptions and really make sure that we're not missing anyone and anything. So we really did that. And then we then again went back to the drawing board, and we made sure that we refined those scenarios. And then we also developed indicators. We really crafted the scenario narratives. You know, we created really engaging and captivating stories. And we produced the visuals that you will see in a minute. As Nikki mentioned, we also organized 2 public roundtables where we invited leaders from a variety of industries. And what these public roundtables did was really to talk about implications, talk about, okay, if this is how things might look like in the next 5 years, then what do we do, right? What do we as a global health community and as a global and international community, and what do we as leaders can do to really either prevent one scenario or perhaps, you know, like enhance our efforts to go closer to another scenario. We are now in the process of completing the technical report, and you will be able to see that in a few days when it will be available. And we are in the process of communicating the outcomes and engage again a broad range of stakeholders. As Nikki mentioned at the beginning, this is not the end, right? But this is the beginning of a consultation period that will last, I don't know, probably 3 to 6 months, where we really invite all of you to really give your feedback and give your opinion on the scenarios, but most importantly on the key messages and the key recommendations and the key next steps that come out of these scenarios. So these are our 4 scenarios. So scenario 1, happy days. Scenario 2, I love you, I hate you. Scenario 3, heartbreak hotel. Scenario 4, here comes trouble. All inspired by song titles and trying to align their content with, you know, what the title really signifies. And I'm gonna now play the film. The film lasts around 5 or 6 minutes. And after that, we're gonna talk very briefly about the key recommendation, the key messages, and then pass it on to our wonderful panel.
What will the future of the COVID-19 pandemic and other infectious threats look like? How will vaccine distribution, trust in science, and economic priorities impact the pandemic and our preparedness for future infectious threats? Will everyone benefit from technological and scientific progress and healthcare innovations while responding to a global climate crisis? Will we take the collective action needed as a global community? Will humanity work together as one? Through collaboration, focus, determination, community empowerment, and hard work, humanity was able to manage the pandemic. Annual booster shots, combined with vaccinations for the flu, ensure that mortality rate from COVID-19 is very small and no higher than the mortality rate of other pathogens. In 2024, the WHO helped prevent the outbreak of another novel coronavirus in Eastern Europe, quickly containing the outbreak and preventing international spread. In 2025, the second generation of vaccines managed to completely contain virus transmission. Other vaccines delivered in pill form further enabled enhanced distribution, reach, and affordability. False information about the pandemic is effectively countered, and nations and healthcare organizations operate based on coordinated common truth campaigns with consistent scientific messaging and guidance. None of the progress that was made following the COVID-19 outbreak would have been possible without a spirit of science-driven decision-making and strategic collaboration between nations worldwide. The virus remains, and it's evolving. Humanity has gradually learned to live with the virus, yet still clings to pre-pandemic behaviors and approaches. New variants appear frequently, which the first generation of vaccines are ineffective against. Through constant testing and continually updated vaccines, the WHO and some countries managed to prevent several additional pandemic waves. But affordability and reliability of rapid tests are still an issue. Trust in governments and public institutions varies across the world. Some attribute the protracted nature of the pandemic solely to the inability of their leaders to make rapid, informed, and inclusive decisions. The boundaries between digital and physical environments are blurred, with hybrid ways of working, meeting, and learning now the norm. Nations are still heavily reliant on fossil fuels, and deforestation prevention has not met the desired targets. The COVID-19 pandemic is not over, and the virus has evolved, becoming even more infectious. New, more threatening variants emerge frequently, leaving vaccine manufacturers struggling to keep up. Long COVID-19 symptoms are the norm for almost everyone who gets infected, putting a significant strain on economies, productivity, and healthcare systems. Each nation focuses their efforts on different fronts. Some focus on measures to inform and educate the public in efforts to reduce transmission, while others focus on reopening their economy, barely able to support their overburdened health systems. Vaccines are the only treatment and prevention option, but access to them depends on the region and country. A large part of the global population is still unvaccinated, with vaccine nationalism and vaccine distribution bias against some minority groups on the rise. The world is suffering from the lack of a unified front to battle the worsening climate emergency. The WHO and the UN are no longer a forum of transparent discussion and collaboration. In addition to a worsening COVID-19 pandemic, a Zika-like vector-borne virus carried by mosquitoes spreads throughout the world. Nations struggle to establish public health measures that do not contradict each other. There is widespread confusion and conflicting priorities about what to do to protect from COVID-19 and the new virus. Given the inability of governments to inform, people turn to those who would provide reassurance during the double pandemic. Trust in society and science has never been lower. Due to intense border restrictions, the aviation and tourism industries have collapsed. People abandon towns in areas with high mosquito density and move to other areas, causing a strain on infrastructure. Healthcare systems, affected by rising cases, backlogs, and staff shortages, find it nearly impossible to cope. Those with higher incomes can afford better care at better staffed facilities. Overall, environmental degradation is accelerating. Species go extinct, and those who survive will be the carriers for the next pandemic. So, what will the next 5 years look like? Will we be able to build consensus as a global community? Can we take the collective action needed to mitigate the ongoing risks of COVID-19? Will we be prepared for future infectious threats? What world would you like to live in?
So I do hope you all enjoyed that. that was a first screening, let's say, of the final video, and you will already notice, or you would have already noticed that, you know, there are some themes mentioned in these 4 scenarios, right? And there are themes and there are mentions to things like trust and collaboration and leadership and science and environment and environmental degradation and climate change. So these are all the themes that kind of were the result of this process, of the scenario planning process. But most importantly, they were the result of a discussion. They were the result of all our consultations or all our engagements with experts, with WHO, and with the public. And this exactly really led us to where we are today, to the visual that you are looking at your screen, which really summarizes the key messages from this exercise. And the key messages are structured around 3 pillars, right? 3 overarching guiding principles that this pandemic preparedness exercise is built upon, but probably these are the pillars that every future pandemic preparedness exercise should be based upon. And these 3 pillars are trust, solidarity and equity, and sustainable development. So as long as we structure our efforts and we structure our pandemic preparedness around these 3 pillars, then we have probably more chances to be successful. So through this exercise, we have identified 5 themes. And these 5 themes are really the areas of focus that are critical for an all-encompassing approach towards the complexity of infectious threats. And these 5 themes are science, environment, and policy, people, communication, and education, economy, infrastructure and systems, technology and innovation, and lastly, leadership and collaboration. And some of these elements you noticed through the scenarios and during the video. And under these 5 key themes, there are some key messages, right? There are these sub-themes that really outline a pathway for action, a framework for action, or the way forward. So what we can actually and actively and pragmatically do to really make sure that we take into account these 5 themes, these 3 pillars, and we are better prepared for the future. And within these key messages, there are a number of practical ways forward, right? There are a number of, you know, like key actions that we can take, that the WHO can take, that the international community can take, and probably each one of us can take to really be better prepared at an individual and collective level for future pandemics. I'm going to very quickly go through the categories and then open it up to our panelists. So just to give you an idea of what these key messages look like, again, this is not detailed, this is not extensive. So please be patient for the final report, which will have, you know, like the full extent of these key messages and their practical ways forward. So on the theme of science, environment, and policy, it is really important, you know, one key message is, okay, how do we work towards a sound science base, right? We really need to be to set up for transparent policy translation, and we really need to master decent management of uncertainty going forward. At the same time, we really need to solidify all these policy and international frameworks for future pandemic preparedness, and, you know, works toward making future pandemic preparedness perhaps, you know, like a global public good. When it comes to people, communication, and education, and, you know, we saw that a lot of the impact of the pandemic had to do with you know, had to do with communication and misinformation and disinformation and different people translating or, you know, like interpreting the messages from the scientific community in a very different way. So one of the key messages here is, okay, we really need to build a knowledge-based capacity in people to really protect them, right? Both at an individual, but also at a collective level from infectious threats. And the way to do that is to really provide early opportunity for regular education through schools, and also to overall enable an environment that really provides that knowledge that is so necessary when dealing with pandemics and infectious threats. Another big theme, another big key message that came out in this category, in this theme, is about youth, is about young people, younger population. So we must actively engage them, right? And we must actively make them part of future pandemic preparedness and really empower them to take responsibility and lead cross-generational action. At the same time, we should recognize that the COVID-19 pandemic is a global human experience, right? It is an experience that really affects everyone. It is something that everyone lives and experiences in a different way. But it is an experience that starts and ends in communities. So the role of communities is really, really important going forward. At the same time, what is really important is to really recognize that different people experience the pandemic in different ways. And this can be, the result of many, many factors, intercultural, religious, generational differences, for example. And all these factors really shape the behaviors of people, right? Different people, different behaviors, different values, and even different ways of accessing information about the pandemic. So all this really has a strong impact on how people react, on how people listen or not listen, for example, to the scientific community, how well people follow public health and social measures, etc., etc. Another big element of this theme, of this category, is mental health, and we saw during the COVID-19 pandemic, the important role of mental health and in dealing with the pandemic. So for the future, it will be really important to make preventive mental health a key component, a key element of any future pandemic preparedness exercise. And then it's all about trust, right? Trust and effective communication. And again, we have seen that, displaying in very stark terms during the COVID-19 pandemic. It is really important to improve trust and communication, not only between governments and citizens, but also between citizens themselves, between the scientific community themselves, and all of these actors as a whole. Now, when it comes to economy, infrastructure, and systems, it goes without doubt that there is a strong need for strengthening the healthcare systems at all levels, across all nations and across all regions. And at the same time, it's not only about strengthening, but it's an opportunity to really rethink how these systems work, right? Is there anything else that we can do to make them better, to make them more resilient, to make them more flexible? Again, when it comes to manufacturing, when it comes to supply chains, which are all part of the wider infrastructure, system, how do we make sure that in the future we build a flexible manufacturing capacity, flexible and adaptive supply chains that can really react and adapt to disruptions caused, for example, by a pandemic? When it comes to technology innovation, and there is a lot of discussion and a lot of talk about technology, and of course, we really need to tap into the potential of new technologies and emerging technologies to improve future pandemic preparedness. However, technology is not, the only solution, right? If we think that technology is the answer, then we really need to be sure about what the question is in the first place. And a lot of that comes with, investing in people as well, right? So it is important to maximize investment in training and future skills, and prepare the next generation of scientists, of leaders, to really use the technology in the most effective way. And last but not least, leadership and collaboration, right? So we have to embrace a One Health approach to future pandemic preparedness and threat planning. We really need to establish a global and equitable approach to pandemic management, and we really need to go away from isolated national interests. And of course, there is like a big question of how we actually do that. And I'm pretty sure that some of our panelists will have an opinion on how to do that, and I'm really looking forward to listen to. And lastly, we have to create an environment of global multilateral collaboration, right? It is all about sharing. It is all about accountability. It is all about responsibility. And it's all about really creating all these mechanisms to diffuse the benefits and act as a collective and adopt a collective approach to pandemic preparedness and management. With that, I will leave you here. I'm conscious that we might be slightly over time, Sarah, so I apologize about that. Please, if there are any questions, please feel free to put them in the Q&A box or reach out to me directly. I'll be more than happy to answer your questions. I hope you enjoyed this. I hope you enjoyed the video. And Sarah, back to you and to our panelists. Thank you very much. Thank you.
Thank you very much, Alexander. I think I personally thought it was a really good video, and looking forward to seeing the report once it's finalized, as are, I'm sure, most of our participants. We're going to slightly shuffle the order of our panelists because I believe one of our panelists needs to leave. And so let me please, I do have the very great pleasure of introducing Governor Yuriko Koka. She is the governor of Tokyo and heads the Tokyo Metropolitan Government since 2016 after serving as the Minister of Defense, Minister of Environment, and other key roles within the government of Japan. So we know that Tokyo is one of the mega cities of the world with a population of 14 million and a population density of over 6,000 per square kilometer. Governor Koike led the organization of the Summer Olympic Games in Tokyo 2020 in the midst of a global pandemic. So I'd like to just express my congratulations to you on the successful organization of the Olympic Games. There is definitely no doubt in how carefully and with a great amount of detail that planning need to take place. I wonder, in the context of the conversations that we're having today, what are the key points of success that you could share with us from that experience of organizing the Games? Welcome, and over to you, Governor Koike.
Thank you, Sarah. Thank you very much for the introduction. And I'm also very pleased to be invited to this special seminar tonight. It's almost 9 o'clock evening here in Tokyo. Well, about the Games, our top priority during the Games was to ensure safety and security. And from the perspective of protecting the health and lives of the people of Tokyo and the people all, we ensured a safe environment throughout the Games. And specifically, we used a playbook of measures, including border controls, behavior management, and testing. And through these efforts, the airport quarantine test positive rate could be held down to 0.1% and just 0.03% in screening tests during the Games. In addition, transportation demand management, TDM, was used during the Games to control traffic volume and movement of people. Looking at the results of big data analysis from sources such as TV ratings and water usage, it appears most people were supporting the Games from home. According to national data, the daily estimated effective reproduction number continued to rise about 1 in June, but fell after peaking on July 22nd. Actually, the following day is the opening ceremony day of the Games, and has continued to decline. And it was thanks to the efforts of cooperation of many people, including the citizens of Tokyo, medical professionals, the Games officials, corporations, and the business community, that the Games were a success. And yes, and also the WHO Secretary General Tedros, Mr. Tedros, attended the opening ceremony and gave his evaluation that we engaged in best practices to minimize the risk. Experts said that the Games were held safely and that testing within the bubble, so-called bubble, and the Olympic and Paralympic Village worked well. The athletes also expressed their gratitude. We received high praise from overseas officials saying things such as this could only have been done by Tokyo. Well, thank you very much for hearing this kind of comments. And furthermore, according to the results of a recent survey by the IOC, 65% of respondents answered that the Games were a success, and 3 billion people worldwide tuned in to watch the Games. So through the power of sports, we were able to unite a world divided by the coronavirus and bring encouragement and hope to people all over the world. Looking forward, we will firmly apply the many experiences gained from the Games to Tokyo's future so that they may leave a legacy of an inclusive society in which diverse people support each other. And a sustainable society aims to achieve SDGs. I think these are the three pillars Alexander had just introduced to us. Thank you.
Thank you very much for sharing with us a wonderful example of collaboration and leadership. And just on that point of leadership with such a large city of 14 million people, trust has come up time and time again in the conversations around the pandemic and pandemic preparedness. And I wonder what your perspectives are on building trust.
Well, for me, trust can be rephrased as a cause and empathy. Without a cause, it would not be possible to make an effective policy. And however, without empathy, the policy will not prevail. In September of 2003, a long time ago, I was appointed as Minister of the Environment. And in order to entice our citizens to take action on large-scale issues such as global warming countermeasures, it was first necessary to have both a cause and empathy. The so-called Kubi's campaign, which was very popular in Japan and Asian countries and many other countries, that I first advocated encouraging office workers to wear lighter clothing during the hot summer months, appealed to citizens' empathy, and became a permanent fixture in our larger climate change countermeasures. I think that the secret to the success of this campaign was to change people's consciousness and show that climate change presents problems that affect people directly and also issues that people can work to solve through their own contribution. And for this reason, even after taking the office of governor of Tokyo since 2016, I have worked to gain empathy among citizens by sharing information clearly and ensuring transparency. And at the initial stage of the COVID pandemic, we worked to launch a dedicated website earlier than most to keep residents up to date with the latest information. Also, I personally used YouTube to broadcast live updates almost every day. The world, including Japan, faced the difficult problem of COVID. And as a leader, I'm required to present information accurately, proactively, craft measures and policy, and provide direction to the people of Tokyo. I personally have this spirit, which I will use to overcome this challenge and build a Tokyo that is full of hope for tomorrow. Thank you.
Thank you very much for your leadership. You've mentioned climate change as a risk. In your view, what do you feel are the other risks for epidemics and pandemics in big megacities like Tokyo?
Well, Tokyo is among the largest cities with over 14 million people. And while our concentration of people and infrastructure has been one of our strengths, it becomes a risk when trying to control infectious disease. And 2 years have passed since the outbreak of the new coronavirus, but from the beginning, Tokyo has called for the avoidance of the so-called 3 Cs, that is closed spaces, crowded places, and closed conversations. And each and every one of us has taken basic measures such as washing hands and wearing masks. And in Japan, wearing a mask has been commonplace for a long time. And it is used to be said that only bank robbers or gangs and Japanese people wear masks. But now mask wearing can be seen around the world. and the healthcare provision system is being strengthened, and companies are being encouraged to curb attendance. The vaccination rate for people over 12 years old now exceeded 80%. The number of new positives in Tokyo was 128 for the past week, including today, for an extremely low rate of 0.91 per 100,000. And crisis management is something that Tokyo can be proud of, and along with high public health awareness among general society and cooperation of people. A new mutated variant called Omicron has also appeared, but in cooperation with the national government, we are strengthening our epidemic prevention system as well as cities' own monitoring systems, such as PCR testing, specially designed to detect Omicron variant, and genome analysis, and are thoroughly implementing basic infection control measures once more in order to prevent the spread of infection. Thank you, Sarah.
Thank you very much for sharing your insights with us. And if possible, we'd like to ask you one last question. Sustainable development has been central to many of these conversations around the future. What are your views in building sustainable cities going forward?
Well, in March of this year, we formulated the Future Tokyo, Tokyo's long-term strategy, a collection of plans for 2030, as a vision for creating a sustainable city that balances growth and maturity. In response to the coronavirus crisis, this strategy aims to realize a sustainable recovery of building a strong and sustainable society rather than simply returning back to pre-COVID conditions. To achieve this, various initiatives have been launched to continue to produce affluent lives for people together with the growth of the city, such as creating a comfortable city that is friendly to people and the environment, and realizing a zero-emission Tokyo by utilizing renewable energy and green hydrogen. These efforts are in line with the SDGs philosophy of creating an inclusive society where no one is left behind. The Future Tokyo strategy is also a roadmap for Tokyo to realize the SDGs. So from an SDGs perspective, we will contribute to the realization of sustainable Tokyo and to improving the sustainability of the earth by taking an active role in developing world-leading policies. Thank you very much, Sarah.
Thank you very much, Governor Koike. It's been a pleasure to listen to you today, and thank you for sharing your insights and your thoughts and your experience in leadership during a very difficult time. I'm aware you may not be able to stay with us for the entirety of the presentation, so I'd like to say thank you now for coming and being with us today.
Thank you very much. Thank you.
Thank you. I'd like to now introduce and welcome Owen James. Owen is the Global Director of the 100 Million Campaign at Kailash Satyarthi Children's Foundation. Owen is an experienced strategic leader and data scientist in the international development, charity, and education sectors. His extensive portfolio and experience has really centered around achieving change for marginalized and excluded children around the world. Welcome, Owen. It's a pleasure to have you. I have a couple of questions for you, if you do not mind. I think you saw the video and you heard Alex's presentation. And I'd be very interested to know from your perspective, given some of those less optimistic scenarios that were presented, if there's a situation where a government has multiple competing demands to deal with, really the issue of those that were already vulnerable and marginalized being brought along and included and looked after becomes even more difficult. So I'd want to know from you, in your perspective, in your thoughts, what would create the most significant change for those, for example, children, vulnerable children? What could we do now that would create the most change in the future if there was a rather pessimistic scenario? Would it be technology? Would it be education, policy? Just interested to hear your thoughts. Over to you.
Thank you very much, Sarah. Very kind introduction, and thank you for the great event today. It was really inspiring to see that film, and I certainly hope when it's released, it gets seen by leaders across the world, because I think it can really help picture the future challenges that people have. I think, one of the thoughts I had in watching it was that the different scenarios, obviously may be different in different countries, just as different countries have had different experiences, during this pandemic. And I think for me, a couple of the different things in the excellent recommendations you have jumped out. One around the solidarity and equity, that is a core principle for the work. If we look at the last 2 years, we see a tremendous inequality in the approach to COVID-19 that has cost more lives. World leaders responded to the challenges. We saw $12 trillion announced in the global agenda for action by the G7. But almost all of that went into businesses and people in richer countries, and less than 0.1% went to people in low-income countries. The world faced a common enemy like never before with COVID-19. It could have united us in our response, and instead, our response has been to leave the poorest and most vulnerable to fend for themselves. We've seen in richer countries, house prices at record levels, the stock market is at a record level. Such has been the big investment in support. In the middle of the pandemic, that is happening. Yet in poorer countries, we've seen an increase in extreme poverty, and tens of millions more children, facing life-threatening poverty. So we have this huge inequality, and that has a massive impact on everyone's future. Even now, there's a complete absence with the rise of Omicron, the lack of commentary in the media connecting that variant with the fact that we've seen Africa have less vaccines than a country like Poland, and the fact that all of our future gets threatened when we leave billions of people unvaccinated, 2 years on from the crisis. So I think that inequality is having an impact on this pandemic, and I think looking at the future, that commitment on solidarity and equity is fundamental if we were to bring a crisis to a speedier finish. The second thing I would like to say is around the recommendations, two excellent ones about treating the COVID-19 health crisis as a moment to rethink the international structures, and the global and equitable approach to pandemic preparedness. And one of the policies that Kailash Satyarthi and the different Nobel laureates in the Laureates and Leaders campaign have been working on is around social protection. It is true that the countries that had already established social protection systems were in a better place to provide that emergency support at the height of the lockdowns and during the height of the crisis, to avoid more people, more lives being at risk because of the severity of the lockdowns. Social protection worked, and it's a mechanism that can be put in place to alleviate all sorts of challenges on the health side, but it would make a tremendous difference on pandemic preparedness. A report that came out in September showed that now is the time actually that we could see social protection rolled out across the world. It would cost just 2 days of the global COVID support to provide a child benefit to every child living in a low-income country in the world. And it would make a transformative difference in terms of resilience and people's capacity to be able to prepare. And as we've seen in case after case, and the World Health Organization has documented so well, in countries where that support system has been right, adherence to the protocols and the isolation is much higher. it is hard to follow guidelines if you're suffering from malnutrition and if you're starving. So an investment in social protection, a global social protection, is an idea whose time has really come, and we hope that coming out of this crisis, we see a real investment. There's youth organizations around the world, the leading student groups in the 100 million campaign you mentioned, they're all calling for greater equity, but in particular global social protection. The UN Secretary General has announced a major new initiative. The big question is, will it get financial support? And we really hope that it will.
Thank you very much, Owen. I think that's an incredibly important point on universal social protection. I'd really like to come back to you at a later stage, but because you mentioned youth, I'd like to go to another one of our panelists. Maureen, I'm going to introduce you. Maureen Rosita Ojong Ebob Besong. Did I get it all right?
Yes,
Maureen is from Cameroon, and Maureen has lived and worked in Gabon and Senegal. Maureen is a sport and development entrepreneur and executive who currently serves as the Director of Programs for the Sport for Education and Economic Development Project, otherwise known as SEED project, based in Senegal. Maureen is a beneficiary of the Sports Integrity Global Alliance Young Female Leaders in Sport Mentoring Program, and she is a young leader in the French African Foundation. Added to her academic and professional activities, Maureen is a singer and a devotee of the arts, sport, and poetry. Welcome, Maureen. It really is a pleasure to have you. And reflecting just on what Owen said, I would really like to know from you your perspectives around the inclusion of young people, not just in protecting them, keeping them safe, but giving them a voice, letting them be part of the decision making. Over to you, Maureen.
Thank you very much, Sarah, and thank you to the WHO for putting together this webinar. I really caught some very pertinent things that Owen said, specifically with regards to engaging young people. You know, like in every development process or every process where we're striving for change, every actor needs to be involved. And young people, of course, are a key piece of that process in preventing, in creating awareness, and in ensuring that as a global community, we're able to fight future pandemics or situations that put our well-being at risk. I think that, first of all, the first way to engage young people is to educate them with content that is relatable to their different contexts. Alexander in his presentation definitely mentioned a recommendation that had to do with people recognizing that the pandemic in different ways and in different perspectives linked to different the realities of different communities. And I think that just touching that point with regards to young people, we have to understand that youth in Senegal and youth in the US or in France have a link to different realities. And that as much as they're youth, they have to be approached in different ways. So the way you communicate and engage a young person with different realities that lives in a more developed setting, or not even more developed, but let me say in Europe, it's not the same way you would engage a young person in Senegal, because they have different realities and they are touched in different ways by the pandemic. Another way, I believe, apart from engaging them by educating them, is to invite them to the table during certain discussions. You know, there's this popular saying that what is done for us cannot be done without us involved. We don't only have to involve youth when, you know, the higher decision makers have decided for us. We need to be involved in that discussion from the onset, to understand the realities of what this piece of the community is leaving. Another aspect that for me really touches I wouldn't call it like the negative consequences, but it's something around that, is that as much as you know, the preventive and the measures that have been put in place to engage and to ensure that communities are much more resilient and united around fighting this pandemic is the fact that we, for example, the digital aspect of it. You know, we've seen that digital innovation has been really instrumental in giving youth, for example, access to more opportunities to engage, to be more aware of what is happening in their environment, and also to be able to carry on their activities, especially with regards to sports, which is something that I personally experienced. But at the same time, this could cause a divide. It could cause a divide, especially in certain communities where you have different social groups that do not have access to the same opportunities. It could cause a divide because sometimes, you know, especially with regards to mental health, people do not live the same realities. People don't have the same access to certain opportunities. So I think that we need to really scale this initiatives in a way that they correspond to the realities of this young target group, and that they're really engaging them in a way that they understand how it applies to your context before the global context, and how at their very minimal level they can be contributing in that, you know, global initiative to fight the pandemic.
Thank you so much, Maureen, for sharing with us. I think very important, nothing about us without us, or for us without us. It's a very important point for us all to remember. And I really commend you on your efforts as well to be a voice for others. So I'd like to come back to you as well at a certain point, but I'd like to first introduce our third panelist, Chitra Massey. Chitra, welcome. So Chitra is the coordinator for the Partnerships and Outreach for Social Justice at the UN Office of the High Commissioner for Human Rights. Chitra was the regional representative of the High Commissioner for Human Rights in the Pacific from 2016 to 2020. And prior to that, Chitra has worked extensively in the field, including countries such as Tanzania and Iraq, on a broad range of human rights issues, including things like climate change, street children, torture, business, countering discrimination, and strengthening national institutions' ability to work with human rights. Chitra, it really is a pleasure to have you with us today to hear your perspective. We've heard a lot about inclusivity and about the need for commitment from authorities and governments and leadership. I just wanted to know from you what your perspectives and reflections were. I have a few more specific questions, but initially, what were your reflections looking at that video and hearing those 5 themes, particularly in the context of your own work and what you do? Chitra, over to you.
Well, thank you very much, Sarah and colleagues at WHO for this invitation, and to be sharing a panel with such distinguished speakers and achievers. So my first initial reflections, my goodness, I'm not sure you'll have enough time to listen to me. I want to congratulate you for your research. Alexander and Nikki, I absolutely loved what you've done. Your videos resonated with me. They are very beautifully done, but they scared the hell out of me. Because for one very simple reason, I see them so possible from the worst to the best, because if there's one thing the pandemic has taught us is that we haven't learned to get it right. We can have the answer right in front of us. We know what we need to do. And yet we are not walking the talk over and over again. And which is why I found your videos exhilarating and terrifying at the same time. I think they must go out to the public very soon. And I really hope that we can have more and more people engaging with them. And to build a consensus around these issues of, yes, we know what needs to be done. I mean, if I just look at it from the perspective of, I'm sorry, I'm just being very broad at the moment, but if as a UN staff member, I look at just one UN agency, my own, In the last 2 years, there must have been at least 50 reports, more than 100 statements from different parts of the UN that have all stated the same thing. Inequalities have been exacerbated. We need universal health coverage. We need equality, greater equality. We need greater access to vaccinations. We need more international solidarity. We need more international cooperation. That this is the need of the hour, and yet nothing seems to change. I look back in parallel to another crisis that is happening in parallel with this unfolding pandemic, which has been going on for a long time. It's the same thing, the climate crisis, right? So when I look at your scenarios, I'm struck, I'm horrified, I mean, I can appreciate the technology, I can appreciate the wonderful way it's been put together, but like I said, it's scary. Because to me, it seems so real that we may be moving not to the happily ever after, despite having the recipe for it. That we may well be heading for not just Heartbreak Hotel, but here comes trouble. It's very, very possible. So this is my sense of it. But Alexander, congratulations. I loved your presentation. I loved what you presented to us. So Nikki, congratulations on such a very innovative project. I wish that I had known about it. I would have loved to have worked with you right from the inception of this project. It's wonderful. Coming back to some of the thoughts that resonated with me as other people spoke. Maureen, congratulations. I think you're doing a wonderful, wonderful, wonderful job. I completely agree with you that youth very often gets to be a little checkbox in the end. And we need to work harder to ensure that youth are at the table from the very beginning. And let me share with you an example of an innovative pilot project that we did in OHCHR. We did a crowdsourcing project, and crowdsourcing, as you know, one of the most famous crowdsourcing examples is Wikipedia. And so we thought, can we use this? And we did a crowdsourcing project with 4 variations. We did one in India without a single penny being invested by the office in the work, other than producing a database and me coordinating with certain volunteers on the ground. It is young people from all over India who are keen to volunteer and who made this project successful in a purely voluntary capacity, working across the breadth and width of the country. We collected over 350 testimonials of promising practices, collected, facilitated, cross-verified by young people without a single penny received. For me, this is one of the biggest testimonies to the fact that young people want to do more, and we need to make sure we're making the space for them. The second thing that resonated with me is that, Nikki, you mentioned it, I think that in the next future, we expect over 170 to 200 outbreaks. If this is the scenario that WHO is giving us today, why are we not getting more infrastructure? Why are we not getting more policy, but no budget allocation into healthcare? I was referring to when we were having this informal conversation, I told Maureen about how Senegal was mentioned. It's an article I read this morning. It was on the IMF blog, and it was an example of how Senegal has been identified as the best practice by this research group, because poor country with one institute, but their preparedness and their community level engagement and investment in healthcare workers at the community level resulted in greater trust of the people and thereby succeeding in holding back the number of deaths and the number of infections. And yet this country is a leading light for us because they shared their know-how and their technology and shared it with countries all around them and inspired other countries to do the same. So I think this is what we need to be looking at. And yes, So again, it talks to us very clearly that the things that we have been hearing consistently from every single presenter and every single researcher, it's about trust. We've seen a number of protests in the years before the pandemic hit us, 2-3 years. What are these protests a symbol of? It's a symbol of the fact that people feel something is not going right, right? We had great hopes, the Arab Spring, people all over the world. In the end of the day, what was it all about? It was all about basic fundamentals of life: water, sanitation, livelihoods, equality of treatment before law. Now, this is where I guess I would come back to another little point that I'd like to make, is that very often people believe that human rights is all about when you hear about somebody being beaten up in a police lockup. And I want to stress and emphasize the fact that economic, social, cultural rights are a fundamental to the existence of every human being. And they are indivisible. All human rights are indivisible and interdependent. If you don't have right to food, you don't have right to life. If you don't have right to food, your right to health is impacted. Your right to health is impacted. Your right to education and your ability to work and earn a decent living is affected. So in fact, my call here would be that my very strong focus is, emphasis is, we've been talking about the fact that human rights are fundamental. At the same time, in the same breath, we are talking that if anything this pandemic has brought before us, that the inequalities have resulted in greater economic inequalities. But we have to remember that to counter these economic inequalities, we need to go back to the fundamentals, which is of ensuring that each of these policies is grounded in the basics of human rights. And what are these basics? They're nothing mind-shattering or rocket science. It's about treating people equally. It's about ensuring that your policy ensures the protection of those left most behind. How do you include? How you have participation? How do you give a voice to the voiceless? Now, as the UN, we all know that this is part of our DNA, right? The UN's DNA, and we have been talking about this for how long? Over 70 years. This has been the challenge that we are trying to address. And now we are all conscious of the fact that given 2030 is around the corner, we may be falling back in our goals of the SDGs. So what needs to happen? What needs to change? I mean, how much more information or statistics do we really, really need? When you were presenting all of this, I was just thinking of all of these issues. So if you ask me what are my initial reactions and what resonated with me, this is it in a nutshell. I could go on, but I will stop here because I know you have questions for the other panelists and I'm very keen to hear them as well. So over to you.
No, thank you, Chitra. It's been really a pleasure to listen to you. And I'd like to give Owen actually a chance to respond, because I think there are many overlapping issues that you both face in your work. And so, Owen, do you have any response to what Chitra was saying?
Well, I just think there's this moment of reflection that we could do, and this different path that we could take. And you know, what I really hope is that in the next period, through this film, through this reflection exercise, and through other debates, we see a sea change in that approach. You know, it's not. It's been well documented. World Health Organization have talked about it, but I'm always struck by the last big pandemic over 100 years ago, and that it was the second year of the pandemic with a new variant that actually was more fatal for young people. That was the biggest killer during the Spanish flu and the so-called Spanish flu influenza outbreak. You know, what are we waiting for when we leave over 1 billion people, 2 billion people unvaccinated? You know, are we waiting for a variant that's not just more transmissible, but that has the same fatality rate for younger people as it currently has for the elderly? We need to see a real commitment on vaccines. We've had the President of the United States promise and commit himself to opening up the vaccine technology. Yet we still continue to deny those developing countries that are requesting the access to make their own vaccines. And this is 2 years after the crisis began. And it's just really frightening that that a couple of countries are able to block that on the international stage, that we're still prioritizing the right of a handful of companies to make billions and billions of pounds off this versus sharing the technology and really trying to put an end and try and contain this crisis. So I think there's something, just as Chitra was saying, it is the result of a long-term inequality. We do live in a very unequal world already, but to see it become so much more unequal through this crisis has been difficult. And if people can't see now that actually in terms of future healthcare and the future, not just other pandemics, but how we complete the behavior on this pandemic, it's in everyone's interest to really accelerate it. So I hope that lesson comes through. And then I hope on the social protection side, we see some action. Globally speaking, social protection is already the largest area of government expenditure in rich countries, in high-income countries. It's by far the largest area of expenditure. And if we could just release 1% of the funds spent on social protection domestically to social protection internationally, like I said, you could roll out child benefit across low-income countries, and you could see a real change. So I hope there are things that come through. But it's inspiring to hear Chitra talk, and it is part of a wider injustice. But I hope we can see some real progress on this in the next few months.
Thank you very much, Owen. Picking up on that point of commitment from leadership, I'm going to actually ask Nikki in a little bit to speak to that. We've just had this special session of the World Health Assembly at WHO, which was calling for our member states to take a step towards more commitment. But before I do, I'd like to just ask Maureen, while we have this need for significant commitment at a political and leadership level, I wanted to know what your thoughts were in terms of the power of the community, of the movement and the pressure coming from within communities, holding their governments accountable to equity and access. And what are your thoughts on that, Maureen?
Thank you very much, Sarah. I think that the community obviously has a great role to play. I think that most of the recommendations that have been proposed today during that presentation, just based on what the panelists have said, there is a great responsibility between community and governments. Governments do not have to only wait for pandemics to set up situations that can prevent adaptability to pandemics. And I'm speaking specifically in developing communities, right, which have really been drastically touched economically and socially by this pandemic, and where communities, especially the most vulnerable communities, have really had to navigate it in the most difficult ways most times. So there is, of course, that ability for communities to create awareness, but also to play a part in ensuring that the different initiatives put in place are able to see the light. Another aspect is that in terms of funding some of these initiatives to help prevent the spread of the pandemic and just equip communities better to adapt to it, you have community members that have a role to play in driving those opportunities and even supporting and funding some of those initiatives. When we're talking about communities, not only the young people, the community leaders, it's also organizations that exist locally in those communities and that whose activities are impacted daily, were able to create value in those communities. So they have a role to play in not only using their voices to create attention, but to work and collaborate with policymakers, to collaborate with government representatives to be able to efficiently prevent and help the community go through this situation. And then the last thing I want to really say is it's also, we always have to take into account, again, the local context. Some people leave, some communities are still in a phase where they believe in traditional measures, where the other part of the world believes in more advanced measures that are adapted to their reality. So there really has to be, as the French people say, a coherence between how information is transferred, how community is engaged in the process, and how it fits with the specific realities. I take for just a simple example, the pandemic has, in some countries, there was a complete shutdown of businesses, where people couldn't operate, people couldn't leave their homes. In developing communities, it's hard. It's really difficult because the social system and the policies that exist do not support those kind of measures. So when you implement it in a community that doesn't have a social system that is strong, that doesn't, where there are different social needs and realities, and which heavily relies on the informal sector, you have a different response. You have a totally different response, and it could be negative, while the real intention is for it to have a positive impact. So those different realities need to continue to be taken into account. And then measures that, of course, are taught from a global perspective, but that are scaled to a local perspective are put in place.
Thank you very much, Maureen, for sharing with us. We're slightly running over time, but I really want to just look at this issue of commitment briefly. So I'm going to ask Nikki, what was the unanimous decision from member states in terms of pandemic preparedness that came out of the special session, just very briefly, and then I'm going to go to Chitra after that, and Chitra, ask for your reflections on that. Working with governments and holding them accountable to some of these measures. So Nikki, over to you.
Thank you, Sarah. So this is really to decide across the member states to set up a very high level commitment by the state leaders level, so president and prime ministers level, to commit to the health security. It's either to take a form of treaty or convention, yet to be decided, but a very high level of political commitment, so that whole world could make sure their engagement towards the safer in the health security arena. The other thing is really to think about WHO governance. Are we still in a driving seat? So we received overwhelming expectation from the member states that WHO still sits in the center of the health policy development, and strengthen WHO so that we were empowered to make people-centered and also based on science policy development for the future. Thank you. I'll stop here.
Thanks, Nikki, for sharing with us. So we have this movement afoot at the political level to get more commitment and accountability. But Chitra, in your experience, you've worked a lot at a national level with governments. What do you think about this? Do you hold hope for our world's leaders in terms of walking the talk, as Owen put it?
Well, I think it's very interesting, because if I can just take a minute to be a very boring lawyer and just remind that governments have voluntarily committed to both the Conventions on Economic, Social, Cultural Rights and Civil and Political Rights. And economic, social, cultural rights is justiciable, is something you can challenge and demand in a court of law. This is something that has been firmly established more than 25, 30 years ago. So we shouldn't even be going into this space whether, can we really claim economic, social, cultural rights? So economic, social, cultural rights is an area where there has been sufficient guidance provided by the Committee on Economic, Social, Cultural Rights and the various special procedures that go with it. And this is the main crux of the matter, is that governments are legally obliged to meet their minimum core obligations using their maximum available resources. This is something that they signed up to, and I'd like you to hold on to that thought because I think it's an important aspect. When we look at the pandemic, what has this really shown us? It has shown us that we are in an unequal world, that certain countries have excellent infrastructure, they have health equipment, they have supplies, they have diagnostic tools, and they are able to also, in many cases, able also to provide social protection networks, which meant that when people were forced to stay away from work, there was a network that supported them and their children. On the other hand, we had countries that already had extremely poor infrastructure, who did not have that equipment or the diagnostic tools, and did not have a social protection network. And then we have a group of countries that perhaps fall in between. They have a little bit of something and a little bit of something and a little form of protection perhaps, and perhaps not. But what we realized was that we have now been left with a big generation that we can talk about as a lost generation, because these are the children who have been left behind due to lack of access to education because of the digital divide. And here, of course, I do acknowledge the fact that in the period of COVID, we have seen amazing innovation at an amazing speed. But if you happen to be in a country or a community that doesn't have access to all of this, then you can only wonder about it. So you have a large number of children, and out of those children, we all know that the gender of the girl child is going to be one that's going to be left behind far more. So here you have this situation. Then you have the fact that governments are supposed to be meeting at least their minimum core obligation with their maximum available resources. What does the budget analysis of most countries in the world show us? That priority has consistently not been in the area of health or education. For the vast majority, these have been on the lower end of the priority, whereas perhaps defense or other things may have gotten higher priority. So clearly this is one area where states need to recognize, and if this pandemic doesn't teach us, then I don't know what else will teach us this reality. We need to recognize the importance of investing in health systems. And that investment has to be long-term. It cannot be a short-term emergency measure. As an immediate knee-jerk reaction or as an immediate response in the best of intentions, with the best of intentions to a pandemic, there were certain short-term emergency measures taken. But when we look back, we step back from this and we look at countries that have done well or that have identified promising practices all across the world, we see that countries that have had more preparedness, because perhaps they faced a previous pandemic, maybe the SARS or the Ebola, that perhaps they had a better preparedness. They had more openness, perhaps, to the instructions they were receiving from governments, that they needed to take certain precautions, that wearing masks was important, using water and soap to wash your hands was important. But of course, if you don't have access to water or sanitation or soap, then what? So I'm going back to this because I want to talk a little bit about the fact that we can recognize the importance, but we also have to make this more accessible. We have to remove barriers that exist. We have to place price caps. We have to make sure that health services may be inaccessible to certain people, that we need to have protection networks for them. And these measures will have to be extended into the long term if we have to truly address the deficiencies that have been revealed. We've heard the term building resilience future, but to build that resilient future, we need to have a greater commitment. Yes, international cooperation and solidarity is critical, but equally the obligation of a state to ensure that the right to health requires them to create a health system that is available, accessible, affordable, and acceptable to all is very critical. And if there's one takeaway I'd like to to ensure is that there is a way available, and it's a comprehensive way, and we need to establish a universal realization of the right to health by establishing a robust system of universal affordable healthcare. I'll stop here because I may be going over the time again, but if you want me to continue, I can come back later.
Thank you so much, Chitra. We would very, very much like to have the time to continue, but unfortunately we are already a little bit over. So just want to say thank you so much to Maureen, Owen, and yourself, Chitra, for the wonderful contributions to the panel. I wish we had more time to continue the discussion. Before we close, I'd really like to give Alex the opportunity to have a final word. Alex, you've been listening, you've been living and breathing this project for the last while. What are your thoughts? I mean, none of us want to have a long-term stay at Heartbreak Hotel, but what are your final thoughts on as we close this out? Over to you.
Thanks. Thank you, Sarah. Yeah, I mean, I was, for many months, like a very integral part of this project, and sometimes you tend to get this tunnel vision and lose perspective. And I was really glad to hear everyone's contribution and input today. So thank you all in the panel. I think in a way you validated our assumptions, you validated what we thought, what we did, what we tried to do, what we tried to achieve, and I'm very, very happy for that. Chitra, I agree, they are terrifying, and like the science and art of foresight is terrifying, and it's very it can be overwhelming at times. But as Nikki said, we do maintain a positive outlook. As a team, we are very positive. We are very optimistic that things will turn out in the right way, probably. The scenarios are all possible, right? I mean, there is no one scenario that's more possible than the others, and I think, Chitra, you really described that very well in your reflections, right? So it is up to us really to to do something or not do something in order to like either go towards scenario 1 or avoid scenario 4. One last thing. I do agree again with Chitra that, like this is not a healthcare crisis only, right? This is a social crisis and technological crisis, environmental, economical, and political crisis, right? What I am really hopeful for, though, is that the COVID-19 pandemic, in combination with, for example, an accelerating climate crisis, made that systemic nature of that challenge a bit more obvious. Right, so hopefully more people do understand now that all these things are connected, right? And tackling one without tackling the other won't get us anywhere. So I think that would be my final thought. It is all about a mindset shift at all levels, right? Within the WHO, in governments, but also like at the individual and community level as well. It will be a two-way interaction, two-way effort, right? It's not going to be bottom-up or a top-down approach only. I mean, it will need everyone to really understand that this is a systemic crisis that we are facing, and if we are to successfully tackle it, we need to successfully tackle all these, like social, technological, economic, environmental, political, and so forth issues.
Thanks very much, Alex. So nothing more really remains for me to do but to say thank you to our panelists once again. Really powerful messages and pertinent reflections, and it's really been a pleasure today to listen to you and to hear. I think, as Nikki mentioned earlier in the session, the report is going to be published very soon and will be open for public comment, I believe. So we should be able to send around more information about that in the very near future. But thank you to all the folks that attended today and listened in, and I do wish you all a very safe rest of the day. So thank you everybody for the time together.
Thank you.
Thank you very much.
Thank you.